That will close the hearing and move to House Bill 1859 and a staff briefing by Mr. Blake.
Chris Blake, again, staff of the House Healthcare and Wellness Committee. House Bill 1859 applies federal nursing home resident rights to all long-term care facilities under state long-term care resident rights provisions. There is a proposed substitute in the electronic bill book that I believe the chair has asked me to speak to, so I will do that. The proposed substitute keeps the elements of the underlying bill, which applies the state long-term care resident rights provisions to all long-term care facilities, which are adult family homes, assisted living facilities, enhanced services facilities, and veterans homes, as well as nursing homes. In addition, the original bill declared that resident rights that have been established for nursing homes in federal law will apply to all other long-term care settings. The proposed substitute adds to the express long-term care resident rights in state law with respect to notice of rights and services, grievances, communications and privacy, access and visitation, transfers and discharges, and quality of life. I won't go over the entire proposed substitute, but it's all covered in the cover sheet. But I'll focus on some of the bigger topics, beginning with transfers and discharges. Current law requires facilities to permit residents to remain there in the facility unless there is an express limitation in law. Before the transfer, certain conditions must be met and notices provided 30 days in advance. The proposed substitute allows transfer or discharge if the resident's health is improved to the point that the facility is no longer needed, and also discharges due to endangerment of individuals in the facility are limited to situations where the endangerment is due to the resident's clinical or behavioral status. Copies of discharge notices must be sent to the long-term care ombuds, and if information in the notice changes, it must be updated, and if the changes are significant, a new 30-day advance notice period begins. The notice must include a statement of the resident's appeal rights. The resident may appeal a transfer or discharge under the Healthcare Authority's Medicaid appeals process, and the facility may not discharge the resident while the appeal is pending, except in certain limited situations. With respect to access and visitation rights, current law lists a number of persons who must be allowed access to a resident, such as the resident's family member or others visiting, as well as state protection agency staff. The proposed substitute requires that access be immediate, and that it also adds the resident representative as one of those identified people who must have access. Long-term care facilities must maintain written policies regarding visitation rights and clinical or safety restrictions, and facilities must ensure that all visitors have equal visitation privileges. On the topic of grievances, current law allows residents the right to voice grievances and receive prompt efforts by the facility to resolve them. The proposed substitute requires that every licensed long-term care facility identify a grievance official to oversee the grievance process and lead investigations. And the DSHS and Department of Veterans Affairs must adopt rules to prohibit discrimination for expressing grievances and corrective actions. I can stop there in the interest of time, unless there are any questions.
Are there some questions for staff? For the committee's information, the public's information, we're going to open this up. We'll hear from a number of folks, but we will continue the hearing because there's a number of folks signed in at our next meeting as well. We'll extend the hearing. So we're going to open up the hearing on 1859, which has already been briefed, and continue testimony. And we'll go to Madam Vice Chair. We're going to have about 25 minutes. So if we don't get to you, you're welcome to submit your comments via written remarks. We'll then hear the rest of the bills, and if we, by chance, happen to have extra time at the end, we'll reopen up the hearing to finish it off. But that's the plan for today. Madam Vice Chair.
Thank you, Mr. Chair. I'm going to call some remote testifiers. First up, we have Karma Maddie Jackson, followed by John Ficker, followed by Karen Marney. And it looks like John might be in person. So John, I'm going to call you first while we queue up those remote testifiers, and we will go to them afterwards. Good afternoon. You have 1 minute.
Good afternoon. Thank you. John Ficker, Adult Family Home Council, here to say in opposition of 1859, not so much in the intent, but the approach. Applying skilled nursing rules to an adult family home violates existing RCW, which in part requires the state to recognize the residential family-like nature of an adult family home and not develop overly complex rules and standards. There is a discharge process in place. It is limited to specific reasons, timelines, and must ensure that the discharge is to a safe location where the resident agrees to go. Office of Administrative Hearing is already hearing appeals related to discharges. But mostly, this approach won't solve the problem. We may be able to reduce or mitigate many discharges if we provide intensive case management or funds to mitigate non-payment of residents. Adult family homes are the only sector in long-term care that is growing. Considering the increased demand we're experiencing, the high up Medicaid occupancy, our ongoing support of the mental health transformation, the DD and ID community, and our continued work to transition residents from hospitals to our setting, we would urge you to please hold off on passing this bill until we have a robust, meaningful stakeholder process. Thank you.
Thank you so much. And now we will go to Karma Maddie Jackson. Good afternoon, Karma. Please unmute yourself and begin. You have 1 minute.
On behalf of assisted living. The federal nursing home regulations in this bill afford a right to care and services not even offered in assisted living and creates a legal mandate that assisted living function beyond reasonable accommodations and outside its disclosed scope of services. Today, by law, a single 30-day discharge notice is provided. When a resident files an appeal, it is usually within that 30-day window. This bill adds at least 60 days to that timeline. This means residents that need ongoing wound care, complex medical care beyond reasonable accommodations will legally remain in that assisted living for at least 60 days. Residents that have behavioral health issues and have assaulted residents or staff will legally remain there for another 60 days. Any resident, Medicaid or private pay, could choose not to pay for shelter, food, or services for another 90 days, creating an unfunded mandate. This bill brings risk and harm to residents and staff and creates undue hardship for providers. I ask that you do not pass it, and I will email you my 2-minute written testimony. Thank you.
Thank you. And now we will go to Karen Marney.
Karen Marney, attorney on behalf of WACA and Leading Age. I represent providers in assisted living discharge appeals. The bill's 90-day window to request an appeal of a discharge notice is too long. It places residents at risk of harm. The appeals process already takes several months from the time the resident requests an appeal until receiving a judge's decision. If the resident receives a 30-day discharge notice and refuses to leave and remain in the facility pending an appeal, the resident stays there. Providers are obligated to ensure a safe location for discharge. Residents are not being forced out. They are not being dumped on the streets. They do remain in the facility pending an appeal. For years, the practice has been 30 days to request an appeal. Adding an extra 2 months to an already months-long process places a resident at risk of not receiving the care that they need and places other residents at risk if the reason for discharge is behaviors. A resident can request an appeal by phone or anyone can do it on their behalf. Vote no on 1859.
Thank you. Now we will go to additional remote testifiers. I have Brad Forbes, followed by Rex Johnson and Adam Cromie. While staff get those in the queue, for the testifiers, please accept the invitation, and then you'll need to unmute yourself and begin your testimony. We have Rex first. Rex, go ahead. You have 1 minute.
Good morning, Chairman Rosidi and members of the House Healthcare and Wellness Committee. Thank you for allowing me to testify in support of House Bill 1859. My name is Rex Johnson. I live in Seattle, and I'm here today as the representative of Washington Advocates for Patient Safety. We are a local grassroots operation promoting patient safety through transparency and accountability. We recognize the need to improve the rights of residents in long-term care and facilities, and we strongly support this legislation. There is no doubt that the rights of residents in long-term facilities should be the same as rights in residents of nursing homes. We feel this bill is an important step forward to improving care in long-term facilities and patient safety. We ask you to please support this bill and pass it out of your committee. I thank you for your time and consideration.
Thank you. Brad Forbes. Good afternoon, Brad. Begin.
Well, thank you very much, Chair Riccelli and committee members. For the record, my name is Brad Forbes, and I'm testifying in favor of House Bill 1859 on behalf of the Alzheimer's Association. House Bill 1859 is about protecting vulnerable adults when they need it the most. When seniors enter long-term care, they do so with the expectation that they will be cared for in that setting for the rest of their lives, and long-term care providers are often aware of a person's needs and diagnoses when they move in. Because of this, residents need to know they have rights and protections that allow them to live without fear of discharge or retribution. People sell off their assets when they enter a contract with a long-term care facility and don't have anywhere to go if they're discharged, leaving them uniquely vulnerable. This bill helps to fix that. House Bill 1859 is necessary to ensure that people receive the right care in the right setting as they age. Thank you.
Thank you. And now we will go to Adam Cromie, and after Adam, we will have Miranda Calmjoy, followed by Emma Kanyora and Kenneth Kagona. Good afternoon, Adam.
My name is Adam Cromie. I'm a staff attorney at Northwest Justice Project. I assist low-income clients with civil legal issues, and I work directly with clients that are discharged or evicted from their long-term care facilities. The team I work on is called a medical legal partnership, so we get our cases referred from medical partners, including Harborview. We regularly work with patients that are medically ready to discharge, but their long-term care facility refuses to take them back. So they get stuck at the hospital for days or months, taking up beds and hospital resources for an already overburdened system, or worse, they end up homeless. One of my clients was sent to Harborview after a fall. After a few days, his medical providers deemed him medically ready to go home, but when he tried to go back to his facility, they refused him entry, like a landlord changing the locks on him. With nowhere to go, he spent the night on the street, and then this man spent nearly a month in the shelter. Illegal discharges like this are happening right now. Without an appeal right, there's simply no way to hold the facilities to the law. Without legislative action clarifying resident rights and appeal rights, the facilities will continue to evict their tenants for literally any reason or no reason at all. Thank you.
Would you like to ask a question? Yes, Representative Simmons.
Hi, Adam, are you still there?
Yes, I am. Sorry.
I wanted to ask you a question. You represent people who are being illegally discharged. Right now, though, isn't there a right already for if they are not safe that they can be transferred right away?
Yeah, there are some exceptions to the standard rights that let the facilities go through the process faster and discharge without some of those things.
Okay, thank you.
Thank you. Moving on, Madam Vice Chair.
Thank you. Now we will go to Miranda Calmjoy. Good afternoon, Miranda. Please begin.
Thank you, Chair Riccelli and members of the committee. My name is Miranda Calmjoy, and I'm a health policy analyst for the State Board of Health. Representative Simmons asked that I share the findings of our health impact review of HB 1859. A health impact review is an objective, nonpartisan, evidence-based analysis of a legislative proposal to determine its likely impacts on health and equity. Evidence indicates that the bill may consolidate state law on resident rights for residents of all long-term care facilities in Washington state. There's unclear evidence how this consolidation may change resident rights. The bill may also lead to DSHS conducting rulemaking related to discharge appeal rights for residents of all long-term care facilities, which may create discharge notice and appeal rights for residents of adult family homes, assisted living facilities, and enhanced services facilities. This may lead to some residents, facility owners, staff, and administrative law judges becoming aware of the discharge notice and appeal process, and some residents using this process. The bill would likely improve health outcomes for some residents and decrease inequities by facility type. There's unclear evidence how provisions may impact equity by resident. The full report is available on the board's website, and I've shared it with you directly. I'm available to answer any questions.
Thank you for your presentation. I don't see any questions, Madam Vice Chair.
Next, we have Emma Kanyora. Please begin.
They are absent from the Zoom room, Madam Vice Chair.
Thank you. We will go on to Kenneth.
Also absent in the Zoom room.
Okay. We will go to Kathy McCall, followed by Noah Seidel, followed by Neil Edgerstead. We're going to have to give staff a minute to call folks into the waiting room. Kathy McCall, followed by Noah Seidel, followed by Neil Edgerstead. Good afternoon, Kathy. Please accept the invitation and begin.
Thank you so much, Chair Riccelli and members of the committee. My name is Kathy McCall. I'm Advocacy Director for AARP here in Washington State in support of House Bill 1859. Decades ago, state lawmakers did just this. They extended the rights, the same types of protections that other tenants receive in other housing settings. These robust rights are under federal law, and all Washington long-term care residents in all care settings should be afforded these rights. But regulations to support those rights were never created. ARP supports 1859 and would direct state agencies to adapt the formal rules required to ensure such protections are carried out for everyone. 1859 will give eviction protections to residents in assisted living adult family homes so that residents have legal recourse when they are unlawfully discharged. 1859 will grant a number of other resident rights. And as a caregiver for my 86-year-old mother, I have experienced firsthand the inconsistency of these rights and regulations across all sectors of our long-term care system. Please support 1859. Thank you.
Thank you. Now we'll move to Noah Seidel.
Good afternoon, Chair Shelley and members of the committee. My name is Noah Seidel, and I'm representing the Office of Developmental Disability Ombuds. The DD Ombuds was created by the legislator to work for the interest of people with developmental disabilities. We're testifying in support of HB 1859. People with intellectual and developmental disabilities live in different types of residential settings and share the same discharge rights regardless of the setting they live in or how their services are paid for. Currently, this is not happening. There are approximately 2,000 people with developmental disabilities who are living in adult family homes, and there is no clear defined process of residential appeal. The DD Ombuds have seen people go into crisis when they are evicted. This has led to hospitalization and institutionalization. When people do find a new home before their eviction, they incur all the costs it takes to move and must find informal supports to help them with this move. HB 1859 is important to ensure all residents of long-term care are treated equitably and have the same rights and protections. It is harmful and confusing for people to have different rights based on where they live. Thank you for your time, and I will submit my testimony.
Thank you very much. And now we will go to our next panelist, Neil Edgerstead, and I will call up our next group in the meantime: Rebecca Mengesha, Rosemary Masava, and Mari Jankovic-Panik. Good afternoon, Neil. Please begin.
Good afternoon. I'm Neil Deckerstead, Regional Long-Term Care Ombudsman for Southwest Washington, here in support of HB 1859. I'd like to share the story of one outspoken resident my volunteer ombuds was working with. He spoke up about not receiving proper medication and call lights going unanswered. His activism made the executive director angry, threatening to discharge him on an almost daily basis for over a year. Then the resident fell in his unit. He laid on the floor, needing medical assistance for 10 hours. He was afraid if he pushed his call light, he would be sent out to the hospital, and the ED would issue him a discharge notice. Eventually, he was taken to the hospital, where he was told he suffered a broken back from the fall. While in the hospital, the ED did exactly what she threatened and issued a discharge notice. Following surgery and rehab, the resident wound up homeless, living on the streets in a wheelchair, recovering from back surgery. The resident appealed his discharge notice.
Thank you, sir. I'm so sorry, your time is concluded.
Please support
Thank you.
1859. Thank you.
You can submit that testimony via email. We'd read it. Thank you. And now we will go to Rebecca. Good afternoon, Rebecca. Please unmute yourself and begin.
They're absent from the Zoom room.
Okay. Do we have Rosemary?
Also absent.
Mary?
Absent, Madam Chair.
Okay. Do we have Jaspreet Kaur? Nikki Storms? Jen Breckel? Amina Abdallah? We have Amina in person. Please come up to the podium. Thank you, Amina. And staff, if you could call those others into the queue. Good afternoon. Please begin.
Right. Good afternoon, committee members. My name is Amina Abdallah, Adult Family Home Counsel, opposed to House Bill 1859. I want to start by saying that no provider wants to discharge a resident unless absolutely necessary. A resident in an adult family home terrorized other residents and staff to the point where the other residents would hide in their rooms and refuse to come out. The home set up alarms, provided panic buttons, and ensured that they had backup caregiver on watch. This occurred during the pandemic at a time where people were dying from COVID, and this resident admitted to going out and soliciting sex, using needles, and doing drugs. A resident in another adult family home physically attacked the provider and the other residents. The police took the resident to the hospital where the provider found the resident in a 4-point restraint. The hospital threatened to have the state called on the provider and get their license taken away if she didn't readmit the resident. She reluctantly asked the hospital to examine the resident. As soon as the staff removes the restraint, the resident runs down the hall, naked, screaming, and assaulting anyone in their path. It took 6 nurses to get that resident back in the restraints. I encourage you all to consider the concerns brought forward with this bill before deciding to move this forward. Thank you.
Thank you.
We have a question, Representative Caldier. Hang tight.
Thank you, Mr. Chair. So, and maybe this is for staff, I don't know, but in the bill, if someone went to the hospital and let's say that they had a hospital stay of, I don't know, 30 days, 45 days, is that home supposed to keep their room, ready and available for them? Or how is that supposed to work? Because sometimes people go to the hospital and we don't know what the outcome is from that.
I guess take a crack at it if you'd like.
I'm actually going to let our executive director, John, here answer, if that's okay.
Yes.
John, if you can come up and answer that quickly.
Thank you. Representative, if an individual is sent to the hospital, at least on the Medicaid program, there is a 20-day bed hold that is funded for that purpose. So someone who has been there for more than 30 days, there would be a question as to whether or not they were going to return, whether or not their baseline was appropriate for that return, and whether or not there was funding to hold the bed any longer beyond the Medicaid funding.
Thank you. Madam Vice Chair.
Thank you, Mr. Chair. I'm back online. I got it. Okay. Jen Brokel, followed by Nikki Storms. Good afternoon, Jen.
Hi, I'm Jen Brockle. I'm the executive director for the Courtyard at Colfax Assisted Living. We've been struggling to care for a resident for 3 years. He's verbally, physically aggressive, non-compliant, severely diabetic, morbidly overweight, completely non-ambulatory. He needs turning 5 times per hour for wound care and regularly requires 3 to 4 people to operate a Hoyer lift to transfer him. We usually have 2 or 3 care staff per shift, so multiple times a day. Every caregiver in the building spends 20 minutes getting bitten, scratched, and spit on while all our other residents go without help. We call in people sometimes who aren't even working just to safely transfer this resident. We simply are not able to adequately care for this resident, and his body fails more every day. Despite multiple attempts to discharge him, he still lacks sustainable and appropriate care. Adding more time and bureaucratic hurdles to this process isn't good for anyone. Please don't pass this bill.
Thank you so much. Now we have Nikki. Good afternoon. Please begin.
Thank you. My name is Nikki Storms, and I'm the administrator at Shayless West Assisted Living. I want to share a story with you today. Shortly after coming to us, we had a resident that began experiencing severe hallucinations that resulted in aggression. After other interventions failed, we followed safe discharge plan requirements to find better placement. During this time, the resident assaulted an employee and then another resident. We had to issue an official discharge notice with a 30-day move out. Despite my nurse and I working many extra hours for those 30 days, this resident assaulted staff several more times. The resident was isolated from others in the wing who feared for their safety, and 2 of my staff members quit, feeling too unsafe to make it through those 30 days. I fear what might have happened had this waiting period been 3 times as long as this bill would require. Forcing us to continue caring for a resident beyond our capabilities for an extended period increases the risk of harm, not only to that resident, but also to the residents and staff who share that space. Please, I ask you, don't pass this bill.
Thank you so much. And now we will go to Susan Harder, followed by Noah Sterling, followed by Laura Tanescu. Do we have Susan?
We have Nola, Madam Vice Chair.
Please proceed. Good afternoon, Nola. Please begin.
Thank you. My name is Nola Sterling. I'm from Seattle, and I'm here in support of HB 1859 related to eviction protections for residents of assisted living facilities. My mother was 97 and had lived in her facility for 5 years. She was a private pay resident with ample financial resources and family advocates. She was nonviolent. She had no dementia. During a brief hospital stay, doctors recommended hospice care upon her return to her home. The executive director of the facility told us she could not return home because of extra care involved, even though we had privately contracted with hospice. We had 2 days from her discharge to find a new home and move her. We were given no options. My mom died a week later in a kind environment, but away from her friends at her former home and the caregivers who knew and loved her. If evictions can happen like this to someone with considerable financial resources and family advocacy, I'm very concerned about what happens to the most vulnerable among our population of assisted living residents. Please pass HB 1859 to support them. Thank you.
Thank you so much. And we will have our last testifier, Susan. Good afternoon, Susan. Please begin. Susan, please unmute yourself and begin your testimony.
I'm so sorry.
It's okay. Keep
Thank
going.
you, Chair. My name is Susan Harter, and I live in an assisted living facility in Yakima. I moved in with assurances that my needs would be met since my medical condition requires dietary restrictions. Soon I was served food without regard to these restrictions and prescription drugs rendered ineffective. Requests for food alternates were denied, and because of this, I was ill and at risk of life-threatening blood clots. They were supposed to provide reasonable accommodations. Instead of this, they were supposed to, I was served an involuntary discharge letter. I was overwhelmed, and when renters across the country were protected against evictions from their homes, this polio survivor in a wheelchair was being evicted within 30 days with nowhere to go. It's still happening. No one should be forced to choose between a roof over their head and healthy food. Please pass HB 1859. Residents of all long-term care facilities have the same rights and protections in that case.
Thank you for your testimony. We do have one more person that I believe is in person, so we will call that person up, and that is Dan Perove. Come on up.
Hi, I'm Dan Peravet. I'm a provider. I own an adult family home in Bellevue. And I've been around the adult family home industry for a long time. My parents owned one since 1995, so I grew up in one. So I saw on the Ombudsman website some of the reasons why they need this bill to be passed. And all of those reasons, we already have laws in the Washington Administrative Code for these things. For instance, nursing homes, right to protect against unlawful discharge or eviction. We can't kick somebody out onto the street. We have to find a place first before we can discharge them. The right to choose your own physician. You have that right. Right to visitors. Visitors can come at any time. We ask, hey, don't come during meal times, don't come too late, but they have that right to come at any time. So it's erroneous to think that they don't have these rights. They're already, in the wax. So to add federal laws to this.
Thank you I appreciate you coming down. With that, we'll actually suspend the hearing on 1859. And just as a reminder, if we have time at the end, we'll come back to the remaining folks. Otherwise, folks can submit their testimony. And we'll move back to open up the hearing on House Bill 1859 and take testimony till the close of this public hearing. Madam Vice Chair.
Thank you, Mr. Chair. I'm just going to go down the list and we'll see if folks are still online and waiting. So first we have Net Sanet Kiffel, followed by Met Gezahe, followed by Aragawi Yakuna, followed by Zilahim Kibide, Laura Tenescu, and that will be it. Okay, Mr. Chair, it appears that the testifiers are having difficulty getting online to testify.
Okay. Please remember you can submit your remarks to the committee, and seeing no more public testimony, we'll close the hearing on House Bill 1859, and we will close committee.